make me not want to, and then they end up wanting to do just that. So it can go either way. Nobody's right, nobody's wrong. It's going to be your experience, and there's tons of work out there in people's homes. One thing I want to stress that we didn't say, but I think you may have alluded to, and I really don't want this misunderstanding, is that we do not take care of patients with severe dementia or Alzheimer's. When I say that, we have a body of patients, and will continue to, that may have a comorbidity of dementia or Alzheimer's as they are going through transitioning. But to have someone go, because that's all we would do, to have someone call and say, I cannot spend another moment, I'm going to.
Yes, and I've had it. And luckily I know who to hook them up to.
We've got resources
but
in
desperate.
the community.
I get calls from the Adult Protection Agency. Can you help? The person can't stand it in the home. And I've called, and I've heard on the phone while I've been trying to help the wife, I'm going to break all the windows here.
It was 2 weeks ago.
Yeah. And I would never send any of you out for that.
You just can't do that. And you can have a judgment around that, but that is healthy boundaries so that we can be an organization that is in patients' homes who cannot afford care otherwise, and comprehensively care for them, offer caregivers respite. But we cannot offer our volunteer organization to a specific body of patients who desperately need help as well. So there's plenty of room for an organization that could be devoted to patients with dementia and Alzheimer's.
It is sad.
And there are resources out there in the Santa Fe community, which we're aware of, for patients with caregivers that are caring for patients with Alzheimer's. But that is not like, oh, I've got a neighbor down the block who gets lost all the time. Maybe I'll call coming home. That's not what we're doing.
No.
Can't be. I mean, we have to have limits. So that's primarily, it's people that have acute or chronic illnesses or are terminal, three kinds, and excluding Alzheimer's and severe dementia.
Mm-hmm. And a lot of my patients, they get better. So they may be going through a cancer treatment and they feel really down, and then they'll get better. So, yes.
On your website, on the website of Coming Home
Connection, yes.
Coming Home Connection, is it any donation space on the website?
Do you know what? I don't know.
No, there is not.
I don't think.
No, but I can take your money anytime.
I was asking because sometimes you talk to people and then they can just go online.
Yeah, there's.
I'm trying to do that. We even have to pay, to get a website up. So that's why I put a lot on the website, then I have to wait till I have a whole lot of other things and then call them up and say, here. Yes.
Do you have a volunteer who manages that?
No. No, I have to pay. I have to pay.
There you go. If you could do that.
I don't know anything about websites, but I have a friend who loves doing that kind of thing for free for people.
Oh, thank you.
If you'd like to do the training in March,
Yeah, that's that.
we'll hire him and give him extra roles if he'll do the website.
Yeah.
And maybe I'll have a little bit of money I could pay him.
He won't be rich.
All right. Thank you.